I'm talking with Nenad Kostanjsek, and he's from WHO, and he's on a program this afternoon talking about traditional medicines, and so we'd like to take a couple minutes to talk about the importance of traditional medicines to pharmacists, physician practices, and can you tell us a little bit about the program that you're going to be presenting this afternoon?
Right. At the moment, we are in WHO revising the International Classification of Disease, and we are working on the development of what we call ICD-11. So it's the 11th revision of the classification. And in that context, we are also developing a traditional medicine chapter, which will be part of the new ICD-11. So that is a new development. If you look back into the history of the classification, it has always responded to emerging information needs in health systems. And starting from the 1900s, where it started off as a cause of death classification, then after the Second World War, when WHO was funded as well, moving into morbidity area and allowing coding of morbidity. And more recently, of course, we have new challenges coming up, particularly around now making sure that ICD can be incorporated in electronic health record environments, that its scientific knowledge is up to date, and that it also links with other domains of health and classifications and clinical terminologies. So this is more or less the context and the rationale for revising the classification. Now, when we look at traditional medicine field, you see that at country level, there are more and more countries and patients who are demanding traditional medicine services. And you have more and more regulators which are calling for more and better regulation of these services. And of course, this is kind of echoed at international level. We have recently adopted the WHO Traditional Medicine Strategy, where we are moving from recognition to regulation, and also asking for more and stronger integration of 3M services into the national health systems. The practice, of course, varies across countries widely. So there's this kind of background, and another important strategy from WHO point of view is the universal health coverage strategy, and of course for many countries traditional medicine services are a very accessible service. So this is on one hand. On the other hand, if you look at the health information system in many countries, you see that traditional medicine is very much neglected. Is not captured.
Yes.
So basically what we are saying is that without being able to count traditional medicine diagnosis and counters, traditional medicine will not count. You cannot regulate it, or it's very, very difficult to do it. So this is the background in why we are developing this particular chapter and want to integrate it into
do you see the ICD-11 codification then as advancing traditional medicines in, I'm from a Western country where there's very little uptake. Do you think that will help those products to be better received?
I think it will definitely, first of all, allow to measure events, the efficacy within the parameters of this medicine paradigm. So to kind of have their own language used to describe it and to measure it. That's number one. And when we talk about specifically, for example, registration of traditional medicine products, I think one of the challenges regulatory authorities are facing nowadays is that they don't have a kind of common reference framework or common agreed international standard to which they can refer to in order to describe the efficacy or the indication of that particular substance.
Yes.
So there is a huge variation in the way the compounds or the properties are described. So in that respect, we hope that this will help in facilitating that kind of work.
Because in the United States, we put traditional medicines in a pot over here, and we know they're not as good, and and only weird people use them, and all those things, and which is not the case, obviously. But
Yeah,
That's
I
our
think
history.
the challenge, of course, is to kind of cover this wide range
Okay.
of situations at country level. I mean, we have countries where traditional medicine is not at all recognized,
Right.
where there is a lack of a regulatory framework. Then you have countries where we see that the regulatory framework is starting to develop. For example, in the United States, just at the moment, as far as I understand, there is a legislation put forward to Congress specifically focusing on acupuncture.
Okay, to recognize
And
that.
I think that for many countries will be a kind of entry point. When we talk about herbal medicine, I think there are more complex issues also with which countries are facing. But I think it's you see that there are countries, what I would say, in the middle, where there
Okay.
is upcoming legislation or already legislation in place. And then you have countries with highly integrated systems. I mean, if you think of China or Korea, for example, where you see traditional medicine and Western medicine very much integrated at hospital level, for example.
So do you make a distinction between herbal and traditional?
In the context of the classification, we are using traditional medicine as the umbrella term.
That's the umbrella. So traditional, we in the West, we think of that as the Far Eastern, medicines and so on. But we also in the United States, we have native peoples, as a lot of countries do, and they have traditional medicines. Would that be included in your consideration?
At this point, we are focusing on what we call developing the Module 1.
Okay.
So this is focusing on classifying traditional medicine conditions of Asian Chinese origin
Okay.
as they are practiced in China, Japan, Korea, and other countries around the world. So that will be the kind of starting point. And we are doing that because we see that there's certain prerequisites and requirements met by these countries in terms of having, for example, a national classification system in place which adheres to certain standards we have to ensure. And from there, we, depending on how we proceed and what progress is made, we may now include other forms of traditional medicine, for example, Ayurveda or other types of well-recognized and established traditional medicine practice.
So WHO and FIP have a long-standing, very close working relationship on a lot of health-related issues. In this particular issue, what do you think going forward is? What's the nature of our relationship? What can we do for each other to advance the issue that you're focused on?
We are now moving with the development of the ICD-11 overall from a phase where we focus mainly on what we call internal development of the classification structure and content to a phase where we expose the current draft of the classification to international peer review and field testing.
Okay.
And in that context, we are very interested to engage with stakeholders worldwide, users of the classifications, to participate in this process. So we would very much like to understand, for example, from a pharmacology point of view, what is the use case you have vis-a-vis the use of ICD-11 overall, but specifically, for example, the traditional medicine chapter, and whether we can really test, in a way, the fitness for purpose for the classification against this particular use case.
So it has value for me as a practitioner in the United States, just as it would for a practitioner in Singapore.
Exactly.
Okay, and that's an important thing.
And I think, for example, one of the areas which here also in the Congress, I guess, is discussed and coming up is research.
Yes.
And there we obviously would like, at the moment, international comparability of research in this area is very difficult because precisely of that lack. So I guess that would be, for example, one area one could.
Well, it's difficult, in fact, and it's also difficult because of the perceptions surrounding the product, and so that is a challenge. And so I'm really pleased that WHO is addressing that. Well, good luck on your presentation this afternoon, and I hope you have a standing room crowd only, and because it is an important issue. Thank you very much.